Hey guys, welcome back to UWorld's Next Gen NCLEX Review. My name is Nicole here with another question drill. Welcome in, guys. If you are not familiar with the question drill and don't know how it works, we go over a certain topic and we go over certain questions that will help you focus on the right types of keywords and key points in that question, and we go over why the right answers are right and the wrong answers are wrong, and just get into a better practice with your NCLEX study tips and test-taking habits. So today's topic is prioritization and delegation. This is something that you guys asked for a couple weeks ago, so we worked it all in. So we'll work on prioritization with the first couple of questions and then move on to delegation. So without further ado, let's get started. The nurse is caring for assigned clients. The nurse should first assess the client who, what? Option 1, has pneumonia and a temperature of 100 degrees Fahrenheit. Option 2, has cellulitis of the right lower leg and a heart rate of 130 beats per minute. Option 3, has ulcerative colitis and severe abdominal cramping. And option 4, has a history of a stroke and is unable to lift the arm on the affected side. Let me know in the chat what you guys think this answer would be. In the chat. Oh, and hello everyone. Thanks for joining in. Love to see it, everyone. On YouTube, Instagram, TikTok, you can join and watch on all your social media platforms. We go live simultaneously and then we post it. YouTube is usually the easiest to find our postings after the live has completed. So let me know what you guys think in the chat. Love to talk to you guys in here, and we'll go from there. I see a lot of people on TikTok today. Great. And I'm seeing a good amount of answer choices, 1s, 2s, and 3s. Let's think of this question, expected versus complication. What are expected findings with the disease process versus a complication of the disease process? Maybe that will help you. And then Miss Nikki Wright from YouTube said that she passed on Tuesday. Congratulations, Nikki. Welcome to the RN world. You are, or no, that's great. That's just awesome news. Congratulations. Okay, correct answer for this one. We're looking at expected versus complication. So the correct answer for this one is has cellulitis of right lower leg and a heart rate of 130 beats per minute. So all the other options, options 1, 3, and 4 are all expected findings. Option 2 is the only one that is leading to something else. So with cellulitis, which is an active infection, and then a heart rate of 130, this is gearing towards sepsis because we have 2 active identifiers of sepsis that can easily turn into septic shock. So this is the priority and someone that we would want to assess first so we can prevent them from spiraling into septic shock. So right now the active infection and the 130 beats per minute is showing as sepsis, which is our priority at the moment. Having a client with pneumonia and a temperature of 100 degrees Fahrenheit, this is to be expected. That 100 degrees Fahrenheit is an expected finding. It's a low-grade fever. It's not a high fever. So something that we would continue to monitor, but not a priority at this time. Option 3, ulcerative colitis with severe abdominal cramping. Again, an expected finding with ulcerative colitis. It's a pretty painful and annoying disease process to have. And then option 4, history of a stroke and is unable to lift the affected arm. Again, an expected finding when you have a stroke. You sometimes will have hemiparesis where you're unable to move one side of your body, and that is being shown here. So good job, guys. Next question. The nurse is caring for assigned clients. The nurse should first assess the client who, what. So again, look for expected findings versus complicated findings. Option 1, has a femur fracture and altered mental status. Option 2, has a hip fracture and a discrepancy in leg length. Option 3, has osteomyelitis and reports pain rated as a 9 on a scale of 0 to 10. And option 4, had a lower leg amputation and reports paresthesia in the amputated foot. Let me know what you guys think. Said, can you move a little? The screen is kind of blocked. I'll try my best. I have a big head, so it's okay. Let me know what you guys think in the chat. And also let me know, are there any recent NCLEX passers, or if you just scheduled for your NCLEX? Let me know. I would love to wish you a good luck or congratulations, give you a shout out, get that boost going. Let me know who is taking their NCLEX or just passed their NCLEX in the chat. Miss Kendra on TikTok is taking her test in 2 weeks. Good luck, Kendra. Way to log in and get some extra practice with us with this live. Someone on TikTok passed in 150 questions. Congratulations, you got all the questions, but you passed, and that's all that matters. So congratulations, great job to you. Miss Kiana on Instagram scheduled hers for May 12th. That's coming up in a couple weeks. Good luck to you. Someone took their NCLEX exam today. My goodness, and you're still tuning in. You need to relax. Just go take a breather. But thanks for tuning in. I pray that you pass. I think that you pass. I know that you pass because you're tuning into UWorld, and UWorld helps you pass on the first try. We have an NCLEX passer here, Daniel Fernil. Congratulations. Welcome to the RN life. Let's see. And then a lot of correct answers in the chat as well. Continue to put all what you think the answer might be in this question. Again, we're looking for a priority. Which one should we assess first based off if it's a complication or an expected finding? Okay, we're going to move on to the correct answer for this one, which would be option 1, has a femur fracture and altered mental status. So for this is keying us for something that we would call a fat embolism, which is when we have a break in a big long bone, such as a femur in this case. That fat that is in the bone can start traveling in our blood system and block or occlude some blood vessels. So in this case, it could occlude some blood vessels in the vein and cause that altered mental status, which would be a high priority. Any blocked blood vessel is a high priority. So that's something that we are going to take into consideration first. So options 2, 3, and 4 are, again, some expected findings that we would see. A client with a hip fracture having a discrepancy in the leg length, that is something that we would see as that hip bone is kind of shifted. Option 3 has osteomyelitis and reports pain rated on a 9 out of 0 or from 0 to 10. Again, an expected finding. Any infection of that bone is going to be painful. And option 4 had a lower leg amputation and reports paresthesia in the amputated foot. That is something, unfortunately, is expected. This is what they call phantom pain, where they start feeling sensation in a limb that is no longer there. So something that to be expected again. But you guys did great. Option 1 is the correct answer because this is the only complication that we see. So, good job. Moving on. The nurse is caring for a client who is experiencing thyroid storm. It would be a priority for the nurse to what? Option 1, initiate beta blocker therapy. Option 2, administer radioactive iodine. Option 3, maintain the client on NPO status. And option 4, place a warming blanket on the client. Let me know what you guys think. If you're just tuning in, we are covering prioritization and delegation. So the first couple of questions are priority type questions. So which one are we going to see? What clients are we trying to see first? And what are expected versus complication type findings? And then we'll go into some delegation type questions. So let me know in the chat. And now that we're kind of like rolling through, if there's anyone from the NSNA conference on, I would love to give you guys a shout out. We just came back this week. Last week, me, Samantha, Nurse Jasmine, we're all on the grounds in Seattle at the NSNA conference, and it was so fun meeting you guys in person. So if anyone is on that was at the conference, we would love to say hi and shout you out. It was great meeting you guys and playing this question drill in real life with some of you guys. Y'all take it very seriously and get very competitive, which is really, really fun to watch and be a part of in real life. So Let me know what you guys think. This is thyroid storm, so it can become a problem very, very quickly. I see that you guys are saying that you can't see it well on TikTok. Nurse Samantha is trying to work her magic behind the camera, so just bear with us for a little bit. But the correct answer for this one is option 1, initiate beta blocker therapy. So thyroid storm is a complication of hyperthyroidism. So that your body is metabolizing and overreacting to the thyroid gland of the thyroid hormones. So in order to treat this, we give some medications such as beta blockers, or you can give anti-thyroid medication, and then you try to cool the body down as much as possible because your body is overreacting and overstimulating. So you want to cool everything down, bring everything down. So one way we do that is initiating that beta blocker therapy, but also doing cooling measures like cooling blankets or cooling IV fluids. Options 2, 3, and 4 are incorrect because option 2, we could do this, but this is not the priority. This isn't the one that's going to work the fastest. Radioactive iodine does help treat hyperthyroidism, but it's not our quickest action. This is more going to be a long-term type of treatment. Option 3, maintain the client on NPO status. This is the exact opposite of what we would want to do. We would want to actually give them food because that energy demand is very high because they're overstimulated and overreacting. So we need to give them food to keep that energy demand and fed, I guess. And then option 4, place a warming blanket on the client. Again, the exact opposite. We want to do cooling measures, so cooling blanket and cool fluids instead of warm. But you guys did pretty good on that one. Good job. Next question. The nurse is assessing a client who has a chest tube attached to a closed chest drainage system. Which of the following findings would be a priority to follow up? Option 1, serous drainage in the collection chamber. Option 2, crepitus around the insertion site. Option 3, intermittent bubbling in the water seal chamber. And option 4, clamp drainage tubing. Let me know what you guys think in the chat. Good job, good job. And I guess, yep, we are halfway through, so time to ask my favorite question. Where are you guys tuning in from? Love to see how far UWorld reaches here in the United States, across the seas, up north, down south. Let me know in the chat where you guys are tuning in from on this lovely Thursday afternoon. Let me know, let me know, let me know. First one in the chat was someone tuning in from the Bahamas on TikTok. Orlando, Philadelphia, the Philippines, Rhode Island, Canada, Monterey, California. I would love to be there on a beach right now. England, Brooklyn, New York. This is when the chat starts going super, super fast, so then it's hard for me to see. Jamaica, Canada, Ohio, Jamaica. There's a lot of people from Jamaica. Illinois, Zimbabwe, Houston, Texas, Hong Kong, Walnut Creek, California, way to be specific, Nigeria, Philippines again, Kenya, India, Miami, Cameroon, Chicago, Cali, Sierra Leone, Germany, Puerto Rico, Kansas City, Missouri. I think that's what KCMO is. Kansas City, Missouri, Ohio, Dallas, Texas. Oh, you're just down the street. Hello, Dallas, Texas, Nebraska, Arizona. I love it when you guys are active in the chat and talking. Love to see it. So also put your answer choices in there, not just your state. Taiwan, New Jersey, Calgary, Ghana. People from all over within the United States, within Texas, within probably area codes and zip codes, and then overseas as well. So thanks guys for tuning in. Love to see UWorld reaching from all over the world. So the correct answer for this one is option 4, clamp drainage tubing. We are looking for a priority. So if we're assessing one of these clients and each client had one of these symptoms, which one would need life-saving measures, which would be option 4. If we have a clamped closed chest drainage system, that means that drainage system isn't even doing its proper duty and what it's there for. That closed chest drainage system is used to create that negative pressure to help with a collapsed lung or to help drain any fluid in that pleural cavity. So if it's clamped, that means we're not having that negative pressure that we need to help reinflate the lungs. So we need to unclamp it, so then we're getting the benefits of the chest tube drainage. All the other options are expected findings with a chest tube. So we're going to see serous drainage in the collection chamber if we're using the chest tube for drainage purposes. That is totally fine. Option 2, crepitus around the insertion site. Again, an expected finding because we have a foreign object like lodged into our body. So we will feel crepitus around the insertion site. We will start feeling or seeing concern if that crepitus starts spreading. So if it goes up into the neck or down to the back and the sides, that's when we would be more concerned. And then option 3, intermittent bubbling in the water seal chamber. Again, an expected finding. We would be more concerned if it's continuous bubbles, because that could mean that there is an air leak. So option 4, if it's clamped, you always wonder why. Always follow the line for every shift. When you're going on to shift, always check the line to make sure nothing is clamped and everything is intact. So good job. Next question, the nurse is caring for assigned clients. The nurse should first assess the client who has what? So another prioritization type question. Option 1, acute myeloid leukemia is receiving chemotherapy and is reporting alopecia and anorexia. Option 2, esophageal cancer is receiving external radiation therapy and has warm red skin on the neck. Option 3, aplastic anemia is scheduled to receive 2 units of packed red blood cells and is reporting fatigue and pallor. And option 4, Hodgkin's lymphoma is scheduled to receive chemotherapy and has distended neck veins. Let me know in the chat what you guys think. And like I said, if any of you guys were at the NSNA conference last week, I would love to give you guys a shout out and say hi, hello, nice to meet you, nice to see you. It was just so good seeing you guys and meeting you guys in person. Makes me excited to see you guys at the mid-year conference. So always already put that on your radar. That is sometime in November. So I'd love to see and meet you guys then as well. So let me know if there's any NSNA people in here. And lots of correct answer choices. Good job, guys. Don't be afraid to put your answer choices in the chat. It's a learning type of thing. We're all here to learn. I see a lot of people also putting the rationale of why certain things are right and other things to look out for. So that is very good. Good job. There's lots of 3s and 4s. So again, think of what would be an expected finding versus what is a complication. What would be expected versus complication? Does that help you with your answer choice? Versus 3 and 4. Lots of 3 and 4. It's like every other answer, someone is putting 3 or 4. Someone says, you're right, I couldn't read, and they changed their answer. So the correct answer, I hope, was option 4 that you put now. Hodgkin's lymphoma is scheduled to receive chemotherapy and has distended neck veins. So this is the only complication that we're seeing with all these disease processes and what they're about to receive. So if a client has distended neck veins and has Hodgkin's lymphoma, this could be concerning that the tumor that they have is compressing on their superior vena cava and is blocking the blood flow back to the heart. So this would be very, very concerning. Any occlusion of blood flow to the heart is going to be a problem. But that distended neck veins is going to be very apparent and something that we need to treat immediately. Options 1, 2, and 3, these are expected findings with these disease processes. A client with leukemia might be reporting alopecia and anorexia, as that chemotherapy can wreak havoc on their system and try immunosuppress a lot of it. So they start losing their hair, they start losing a lot of weight. So that is unfortunately expected finding. Esophageal cancer receiving radiation therapy has a warm red skin on the neck. Again, esophageal cancer, so in the neck, and they're experiencing or getting radiation therapy, which is an outside external type of therapy they use to treat cancer. So to see the warm red skin is an expected thing to see, since that radiation is coming from the outside in. Aplastic anemia is scheduled to receive 2 units of packed red blood cell. Anemia is a low blood count, so them getting 2 units of blood, as well as reporting fatigue and pallor, is expected because they don't have that blood in their system to keep them energized and to keep their skin warm instead of that cool, clammy, paler skin that they're seeing. So option 4 is the only complications that we are finding here. So we're going to move on to some delegation type questions. So take a look at these scopes of practice, the differences between an RN or LPN and LVN and a UAP. Kind of get this into your head, try to memorize it. You can screenshot it even if you would like, to kind of help you answer these next few questions. The main key difference here, or what I try to think of whenever I'm answering these questions, is an RN is someone who's going to initiate everything. They're going to begin and end. So they're going to initiate any teaching, initiate any type of assessment, initiate any intervention. They also want to be the last one doing any assessments or doing discharge teaching or teaching at the end. The LPN and the LVN is someone that's going to continue to do everything that the nurse has already initiated. So they're going to continue to monitor, they're going to do any routine assessments, they're just going to maintain that flow. And then the UAP is the person that, again, also helps with the flow, but these are like the most stable, routine, daily living type of things that they are helping with. So they're not going to initiate or do any ending type thing. So RN does beginning and end. The LPN or LVN does everything usually in the middle, and the UAP kind of helps as well with everything throughout the middle as well. So now that you understand all this, let's go on to our first question. The nurse and licensed practice nurse, also LPN, are caring for assigned clients. Which of the following activities would be appropriate for the nurse to assign to the LPN? So which one can the LPN take care of? Select all to apply. So more than one right answer. Option 1, create a plan of care for a client with chronic stable angina. Option 2, measure a client with heart failure for anti-embolism stockings. Option 3, select discharge teaching topics for a client with atrial fibrillation. Option 4, administer enoxaparin to a client who's receiving skeletal traction. And option 5, apply a sequential compression device for a client with limited mobility. Let me know what you guys think an LPN would be able to take care of. Good job. Lots of good answers. Oh, what did that one say? Someone was asking, she graduated 2 years ago and is about to take her NCLEX. Do you think UWorld is going to help me pass? I guarantee UWorld will help you pass. We have a very high pass rate with UWorld. Just use our resources and study, and you'll pass on your first try. Lots of good answer choices. It's a select all that apply, so it's more than one right answer. Miss Allie on Instagram, just 10 days till her NCLEX exam. Good luck. Way to tune in and get some more studying time in. You're gonna do great. Gonna do absolutely great. Okay, correct answer for this one. So scope of practice of an LPN or an LVN would be options 2, 4, and 5. So think of all the things that can continue the plan of care for a client. They can measure a client with heart failure or anti-embolism stockings. This isn't initiating anything. They're just measuring to continue the care with the anti-embolism stocking. It's a stable type of thing. There's no risk factor with just measuring a client's leg for stocking. So this is okay for them to do. Administer enoxaparin to a client who is receiving skeletal traction. Again, this is a routine medication that a client on a skeletal traction would be on, so it's okay for them to continue doing. And then applying a sequential compression device or an SCD to a client with limited mobility. Again, it's continuing on the care, so it is okay and it's routine for this client to be on, most clients actually, to be on an SCD machine. Options 1 and 3, create a plan. Again, that's initiating something. So creating a plan of care for a client with chronic stable angina. This is something that the nurse would do. It's within the nurse's scope of practice to initiate a care plan. And then select discharge teaching topics for a client with atrial fibrillation. Again, the ending, doing discharge teaching. So teaching in the beginning and teaching at the end are all things that the registered nurse would be doing. So that is why those answers are not selected. But good job. Let's try for another question. The nurse and unlicensed assisted personnel, UAP, are caring for assigned clients. Which of the following activities would be appropriate for the nurse to assign to the UAP? So we went down from the LVN, now we're going to a UAP, or a care technician, or the patient care tech, depending on what area you are, or what side of the country, or what hospital system, they can call it different things. So what would the UAP be in charge of? Option 1, assist a client to the bathroom for the first time following surgery. Option 2, feed a client with dementia who has a serum glucose level of 70. Option 3, explain why incentive spirometer use is important to a client with postoperative pneumonia. And option 4, take vital signs every 15 minutes on a client who just transferred from the post-anesthesia recovery unit. Let me know in the chat what you guys think. And also let me know what type of topics you guys would like for us to see. A couple weeks ago we asked, and y'all said prioritization and delegation. We included it. Now let me know what other things you guys would like for us to go over, or some more prioritization type questions. What topics would you want us to cover in the next couple of weeks? Neuro, case studies, more case studies. Case studies are in-depth type of things. Pharmacology is always our number one ask. Pharmacology and cardiology. Psych, maternity, that's something for Samantha. Case study. Endocrine, pharm, infection control. That's not something that we go over too often. So yeah, infection control would be good. More case study, pediatrics and OB, prioritization, cardiac, renal, mental health. Oh, someone said I'm a very good teacher. Thank you. I appreciate it. I'm glad you're learning something. Infection control, lots of case study requests. That is noted for sure. Keep dropping in what you guys think we should cover in the next couple of weeks, and I will give you the answer to this one. The things that a UAP can take care of is option 2. Feed a client with dementia who has a serum glucose level of 70. So this, out of these 4 patients, this client is the most stable, and we're doing the most routine type of thing. So this and an activity of daily living, which is a regular thing that we would probably do every single day, which is bathing, getting dressed, brushing our teeth, our hygiene type things, and then as well as eating. So option 2 is a thing that activity of daily living that a UAP can do, which is feeding the client. Although the serum glucose level is 70, which is on our lower end, there's nothing in the answer choice that is giving us an indication that something is about to go wrong. So feeding the client with a glucose of 70, that's surely going to bring the blood sugar up. So it's the most stable. It's okay for the UAP to take care of. Options 1, 3, and 4 would definitely be something that the nurse would want to take care of. For option 1, assist the client to the bathroom for the first time following surgery. So like I said before, the nurse should be the first one doing all the first assessments or initial things. So that includes assisting to the bathroom just in case there's any complications that might happen with that first walk to the bathroom. The nurse should be there to just monitor and make sure nothing goes wrong. Option 3, explain why incentive spirometer use is important. Again, this is initiating teaching about incentive spirometer, so that is in the scope of an RN, which would be initiating teaching. And then option 4, take vital signs every 15 minutes on a client who was just transferred from the PACU. Again, we're initiating that first couple assessments, which is those vital signs every 15 minutes. And again, that's something that things can change. Complications can arise very soon and quickly, especially after the post-anesthesia unit. So that nurse needs to be there to do those assessments. And especially every 15 minutes is pretty frequent. So there's definitely probably something that we're looking out for. So that's in the scope of a nurse. But you guys did great on that one. Good job. Last question of the day. The nurse is caring for a client who's confused and is in soft wrist restraints. Which of the following activities would be appropriate for the nurse to assign to the UAP, the unlicensed assisted personnel? Select all that apply. Option 1, assist the client with using a bedpan. Option 2, check circulation and sensation of the extremities. Option 3, perform range of motion exercises. Option 4, report changes in skin integrity. And option 5, turn and reposition the client in bed. Which one would the UAP be able to do? Select all that apply. So more than one right answer. Think of routine, regular things, no assessments, cough, cough. Let me know what you guys think in the chat. Also, we are trying to help you guys in the best way possible by adding times, switching our times. So we have added an evening time actually started a couple weeks ago, 7 p.m. on Wednesdays. We have Nurse Andrew going live with our topics as well. So if that is something that you like and are interested, at the end of the day, maybe while you're eating dinner, to do a quick question drill, he goes live every Wednesday at 7 p.m. And I think we're also going to add him on Friday as well. So Friday night, late night session, not late night, but 7 p.m. type session. Nurse Andrew will also be here in the after hours. So let us know if that works for you, or if y'all suggest a different time that might be better. Maybe that Friday night one is no good because y'all are out partying. Maybe, maybe not. Let us know any other evening times that might be beneficial to you guys. Would a Monday night work? 7 p.m. is too late, so what other time? Make sure you also let us know your time zone, because that is different for everywhere. Good job, good job. Someone said it's not a SATA. It is a SATA question. So there are more than one right answers for this one. So all the things that a UAP is able to do. This is a SATA question. Select all that apply. So the correct answer for this one, the scope of practice for a UAP would be options 1, 3, 4, and 5. I gave you all a hint with that assessment type of thing. Option 2 would be an assessment thing. Checking circulation and sensation of the extremities is an assessment that a nurse should be doing. But options 1, 3, 4, and 5, these are regular activity or ADLs, assisting the client to use a bedpan. Again, going to the bathroom is a normal activity daily of living. We all go to the bathroom more than one time a day. Option 3, perform range of motion exercises. Again, that regular movement within our body is something that we do every day or should be doing every day. excuse me, report changes in skin integrity. So I'm not doing a full-on assessment, but if the client or the UAP is cleaning up after a bedpan and they notice something different, reporting any changes would be something okay for the UAP and definitely something that we would want them to do. Because they have eyes on sometimes things that we haven't seen before. So reporting changes in skin integrity is definitely something that they can do. And then turn and reposition in the client, again, movement is okay, and turning and repositioning is okay because it's not an assessment or education. So good job, guys. Y'all did great today. I hope you guys learned something new with prioritization or some delegation, and continue to let us know what you guys would need from us in the next couple of weeks. We are here to help you guys and be a great resource as you study and get ready for your NCLEX. So I will see you guys next week. Bye. Have a good weekend.